Hi, friends. Are you tired of dealing with this pandemic yet? I know I am. And I know this is hard for so many of us. After all, nobody wants to wear a mask. None of us signed up to keep distance from people we know and love. And who wants to keep track of how full our ICUs are and how much virus is transmitting in the community? Really, we'd all like some normalcy, wouldn't we? Especially in church. We'd like to go back and share the peace again. Sing together again. Have coffee hour together. But the Delta variant is not giving us our way. As cases increase around the nation, especially among our children who can't be vaccinated and among unvaccinated adults, we have to find a longer-term way of thinking about loving our neighbors as Christians during this abnormal time. So individually, this means we can wear masks, especially around children and unvaccinated adults. And if we haven't received the vaccine, we can wear masks if we're going to go out in public and in groups. We can, of course, wash our hands. We've all gotten really good at this. And it does help to keep some distance between folks who are not in the same family or community bubbles. But as church, there's actually some more stuff we can do. One of the key ones is increasing ventilation in our gathering spaces. Now that could happen by going outside or by opening windows for cross ventilation, maybe by having a professional in to look at the heating or air conditioning system and figure out if there's a way to bring more fresh air in, or to use filters or ultraviolet to catch particles before they circulate in the room. We also have to be concerned not just with how far people stay from each other, the physical distancing, but with the concentration of people within the space. We know that COVID-19 is a virus that spreads through aerosols, which means, essentially, we get it by breathing each other's air, which is what we do when we're together in a room. Experts tell us that it can take 15 minutes or less breathing air shared with someone who is infected with the virus to get a significant dose, an illness-producing dose of the Delta variant. And of course, we don't always know who's infected because people are infected without having any symptoms. We have to understand that our risk is not just ours, it's our community's. And that risk is calculated by how much virus is circulating in the community, how long people are together in enclosed spaces, and how close they are together. And reducing any one of those factors can reduce the overall risk for ourselves and for our neighbors. Epidemiologists simply don't know if Delta is going to rapidly fall off like it has in some other countries, or if we're going to see continually growing cases as people return to work and children and teachers return to school. We don't know. What we do know is experts are saying that it could be 4 to 6 weeks until we see a peak of cases, after which there will need to be a decline, and we don't know if we will return to a pre-Delta baseline. In other words, this isn't over yet. Before going to the cross, Jesus told his disciples, "I give you a new commandment, that you love one another. Just as I have loved you, you should also love one another. By this, everyone will know that you're my disciples, if you have love for one another." Now, we as Lutherans show our love for our neighbors in all kinds of ways. We feed the hungry. We take care of people who've been ravaged by floods and tornadoes. We care for the houseless. And the list goes on and on. So let's make sure that people see our Lutheran witness of doing everything we can to reduce the length and severity of this pandemic.